alternative medicine. He has a diploma in project management and advanced computing. He is presently doing PhD in weight loss. So you have a great expert over here. His contribution to the society is that he has written a book named Dyttitude. It is available on Amazon. Please do check it out. And he has his own YouTube channel as well as Facebook page named Dyttitude. Presently, he is working in TCS and also doing PhD. The stage is all yours, Mr. Raghavendra. Please go ahead.
Thank you, Vaishali ji. Very good morning, all those people who have joined. Very good morning to you, and thank you for your time. I'm sure next 1 hour. I'm not going to go to that level where you will say the 1 hour is wasted. I'm sure that 1 hour should change your life. That is my aim. And as Vaishali ji was going through the degrees and education, my blood pressure was increasing, though it is a anti-hypertensive session or a session on the hypertension, how to reduce hypertension or how to take care of blood pressure. So that what happens. I have come across people who joined yoga L1, L2 or L3, and they say there is an exam, and it is really a very bad thing if I'm going to fail. So point is, in yoga exam you are increasing your blood pressure, and I come across such people and have gone through the same feeling, and then I thought that if I'm going to increase my blood pressure by appearing for this exam, then this is not a correct exam, or I'm not a correct person to appear for this exam. So inadvertently, unknowingly, we raise our blood pressure here and there. So what we are going to do today, I'll brief you out about some of the key points about blood pressure, and then we will go for question answer session. So first of all, whenever you will find that when we conduct interview, any interview in any IT industry, the key question we ask people whether you are interested in solution or problem. And I'm sure most of you, they must be interested in solution, but the actual answer is that you should be interested in the root of the problem or the actual problem, because half of the solution is understanding the problem. If you understand the problem completely, then the solution is very easy, because there are only choices which are left are that this is the solution, these are the levels of solution, these are the phases of solutions, and these are the number of solutions, and we have to choose the best out of it. So first we should understand what is blood pressure very quickly, and then we will go for how we can actually try to control it. Many people, they'll find some kind of sweating sometimes, or nausea or weakness or dizziness or palpitation sometimes, or shortness of breath, or they will have a cranky or angry over the period of time. And these kind of characteristic, you will find that over the period of time they may have a blood pressure. This particular blood pressure, the systolic is generally 120 and diastolic is 80. Where systolic, it means when our heart, it actually compress at that point of time, the blood pressure, that is a 120 mm of mercury. And when it relaxes, so when heart relaxes, the deoxygenated blood flows into heart, and when it actually compresses, the oxygenated blood flows to the body. So this kind of cycle is going on completely, day in, day out, 24/7. Heart is the only organ which doesn't have any rest anytime, 24/7, every second. So when actually it relaxes, which is a diastolic blood pressure, that also should not get high, and the systolic blood pressure should not also get high. If it is more than that. It is said that it can be a pre-blood pressure, pre-high blood pressure stage. So there are actually, they have done the sections of it. So for example, the first stage of it, which is a blood pressure stage, is that the blood pressure may be 90, less than 90 but more than 80, and 140, less than 140. So these kind of blood pressure are seen in many of the health aspirants, and it can be reverted back very easily by controlling your lifestyle, by yoga. If it is more than 140 systolic, and diastolic more than 100, less than 100 but more than 90, then it becomes very difficult over the period of time, because the habits of a person will be such that this particular blood pressure may lead to the higher blood pressure. When it is above 160 and above 100, then it is very clear that you should not think of any alternative things. You should think of immediate doctor. Even in other cases also, you should go to the doctor. You should never avoid doctor, because all other therapies which are there, which are actually supporting therapy. Yoga, as you know, yoga's definition is a preventive medicine. It is a preventive therapy. It comes under the prevention and not under cure. But no doubt that sometimes, for example, in case of alternative medicine, by Ministry of Ayush, it has been classified that some of the blood pressure which are not above 140, they can sometimes be revert back to its original, depending on the cause of the blood pressure. So let's come to the cause of the blood pressure. Why it increases? There are two major causes on which this particular blood pressure depends. The first one is volume of blood. Simple. If you take more water, the blood pressure increases. But that does not mean the person will have blood pressure. It is partial increase. If the density of blood increases, volume of blood increases, then the blood pressure rises more and more. The density of blood depends on various different factors. So for example, there is more cholesterol in the blood, there is more kind of crystals in the blood, there are more kind of fat in the blood. So there are a number of different complexes, different metabolites, which are not thrown out of the body, they remain in the blood, and that is what we say in a layman's language is a impure blood. Okay, and they increases the density. One of the major factor which is responsible for increasing the density of blood is sugar. So a person who has a sugar, who has a blood pressure, and who has a cholesterol, probably it's only God who can save him. So if the person is diabetic, most of the time, if he is not been treated, then lead to high blood pressure. If the person is having high blood pressure, there are likely that chances are there that the person may get diabetes because of high BP, but not always. Okay, so these diseases, they are friend of each other, so be the two foes which are there, we should always keep ourselves away from them. That is the first reason, that the volume and density of the blood increases. The second reason, what you can say, that the diameter of arteries, because of the depositions, not coronary artery I'm saying, I'm talking about the other arteries. The artery, they are generally thick in their wall, and these arteries, when receives more and more deposition inside the arteriole, which is actually the inside orifice of artery, which is responsible for sustaining the pressure, it get reduced, or it gets sometimes hardened, and as a result of it, the heart has to pump the blood to reach out to every capillary or periphery of the body with a large pressure, high pressure, and as a result of it, the pressure, systolic pressure, increases. And if there are more and more depositions are there, then definitely the blood pressure required will be more and more, and as a result of it, the problems which are like sweating and all other things, they occur. Of course, You have a high blood pressure, that does not mean that you may have a cardiac problems, but definitely heart will have a load always. A very important point here is that whenever there is a high blood pressure, that person may not come to know that I have high BP, and that is where the whole game is very different. People who have more than even 5 or 6 years they are sustaining with their blood pressure may not come to know. So every year you should check your blood pressure, every year. No doubt about it that where if you go by car and go to the hospital and immediately check your blood pressure, it will never be 120/80. That is true. Okay, that does not mean that you have a blood pressure. If you go by car, definitely during driving your blood pressure rises. During winter your blood pressure rises. Okay, if you are in stress, your blood pressure automatically rises, but that does not mean you have a blood pressure. If it crosses the limits, then only you have a blood pressure. So the person who doesn't check his blood pressure every year is in danger. That is the first key thing. So we should not avoid that. Okay, we are doing yoga, that does not mean we should not check blood pressure. We should check blood pressure. There are also nowadays digital blood pressure machines are there, though it is now that the mercury is not used because it spoils the environment and it is a heavy metal and all those things are there, and that's why now mercury is not used. There are a number of instruments which are used for getting a correct blood pressure out of it. But of course digital will give you some type of what you can say rough blood pressure, where the range of blood pressure. It is also said that if your left hand blood pressure is not equal to right hand blood pressure, probably and if it is more than 10 mm, then there is a challenge that your body balance has a difference, and definitely you should go to doctor. That is another paper I read, and but there are physiological differences of this are to be checked. This particular thing, there are a lot of research is going on this, particularly the sides or bilateral sides of body and blood pressure relation. So that is also there. Why? But we should have, if we have a high blood pressure, uh, we don't have any problem, then why should I check? Okay, that's the question. The reason is, it is a silent killer. The reason is that when there is a high blood pressure, at that point of time, there are chances that your cranial nerve, your brain nerves, your brain capillaries may get damaged, and there may be a blood flow out of the capillaries, blood flow out, and then it may cause a clot, and that may lead to a neuropathy, that may lead to a paralysis, that may lead to your brain attacks, that may lead lot of things, and that will be very delicate. This portion is very delicate. Which part of your brain affected, a corresponding part in your body will get affected. That is the reason that my request to everybody, whoever taking tablets of blood pressure to reduce the blood pressure prescribed by physician and doctor, family doctor, please don't stop them without the consent of your doctor. That is the key thing first we should remember. It does not mean that we are doing yoga, we should stop the tablets, and that may cause lot of disaster. So very important request. Let's come to something which is actually what we can say that will go towards how can we prevent this particular thing to occur, or how can we revert this particular thing to occur. A very important portion which I left, but very important thing, sodium. The sodium, what you can say, salt. The sodium has a huge effect on blood pressure. How it is? It has an effect on brain, it has an effect on the volume, osmolality of blood pressure, osmolality of blood, sorry, not blood pressure, osmolality of blood. Osmolality is actually a property which is by the colloidal particles inside the blood, and if it is increased, osmolality increased, definitely the density is high, and as a result of it there are chances that the BP will be high, and there are constrictions of the blood vessels also, and as a result of it the BP will be shoot up. So sodium is a key factor, even the calcium though it is good for our body, but definitely deposition of calcium crystals may cause a problem. So uh, the major factor which actually affects our blood pressure is also environment. Whenever there is a cold, the our blood pressure rises. Major another factor which is responsible for changing blood pressure daytime or nighttime. For example, our high blood pressure is there early morning. So you will find that most of the blood pressure patients who got actually who caused a death, whose death is responsible by just blood pressure or by nerve damage or by the capillary damage, these people they generally passed away early morning. This because there is a damage in the brain, there's a blood clot, and uh, and it causes a neuropathy, it causes clotting, and as a result of it early morning, because of very high blood pressure, they pass away. That is where the day, in a whole day, early morning we have to take care of it. A person who has a blood pressure should never wake up with a sudden jerk. The person should first wake up by just opening the eyes. The person should give at least 30 seconds by with open eyes, lying down. This first signal gives to the body that our body is now just waking up. That is the first signal. Second, the person should sit down and just be as it is. When the person wakes up, be as it is. Do not think of anything. Just open your eyes, let the body start its complete mechanism to normalize, and then after that just start walking very slowly, without any thought in mind, without any thinking, and then start your day. After a complete 2 to 3 minutes, it's very very big time, early morning, 2 to 3 minutes of time you have to give to the body to at least normalize it. Otherwise it may cause lots and lots of challenges. So one more factor which affects our blood pressure is definitely urine. If generally even in those people who are suffering from hypertension, very high hypertension, they have been prescribed with the diuretics which actually cause urine, and as a result of it it reduces the blood pressure. So diuretics are considered as a anti hypertensive drug. There are different drugs which are given in allopathy. Some are they are relaxing the arteries, some they are reducing the density of the blood, some they have different names depending on their mechanism of action, like beta blocker, calcium channel blockers, like that. And some have reduce the volume of the blood by diuresis, or a number of different mechanisms. So these kind of treatment of allopathy, it is a symptomatic treatment. Okay, this particular treatment is to prevent your damage to the body. It is not a treatment to treat or to eradicate the root cause of blood pressure, and there is actually the yoga comes into play. So root cause of blood pressure, maybe the first thing is the lifestyle. For example, if our lifestyle is that we are eating, say if we come to the eating portion of it, say we are eating lots and lots of condiments, chutney, right, lots of what you can say, the processed food, then lots of food which having preservative, lots of food having different kinds of salt. Salt is salt, whether it's a black salt or white salt. lots of thing which has say white thing, so white rice, okay, white maida, or white, what you can say, the besan. So all these things contribute to the blood pressure ultimately. So another thing is quantity contributes. Quantity, if the quantity of your food is high, it is likely that the person will suffer from blood pressure. It is, there are many different kind of approaches in sattvic sciences and holistic medicine they have been taken. First thing is, your food should never be up to that mark that it will fill your stomach. They say that, as per our yogic sciences, it is said that you should able to eat same amount of food what you actually have taken just now. That is the correct amount of food you have to choose. So amount wise, you should immediately able to eat same amount of food. If you have taken 2 bhakris, then you should able to eat without any indigestion 2 bhakris again. That is the correct amount of food. That's the first thing. One very important point about food is that when you eat food, first of all you have to chew well, right? You have to chew it at least 32 to 40 times, so that those people who have high pitta, and because of that which causes blood pressure, then that won't be there. Blood pressure can also be attributed to pitta, vat, kapha. It doesn't leave anybody, it doesn't have any partiality. Okay, all types of people, they will have blood pressure, but again the treatment for each person will be different. What I am actually suggesting about those people is a generic generic approach, but it is a discussion of every different type of people, what type of people, or kapha or pitta type of people are there, right? So here the amount of food should be half of what actually you are eating when you are full stomach. That is a first very important portion of it. The second, you should have the if it is possible, reduce the salt as much as possible, the reason is that water has a salt, your every edible what we have has a salt, everything has a salt. So as a result of it, our salt requirement gets suffice without taking salt itself. And everything has a sodium. Chloride, there is no dearth of chloride in our body. There is no dearth because chloride is present everywhere. Our HCl itself is a chloride. HCl is a acid, so hydrogen chloride, which is a hydrochloric acid, right? So chloride, there is no dearth. Sodium is again there everywhere. So as a result of it, if we eat more and more sodium, more and more salt somewhere, then it's a problem. The major one is papad. That is the key one. Papad has huge amount of salt. Condiments have huge amount of salt. So salt we should avoid. We should avoid full stomach. If you are taking full stomach anytime, result always in at least a deposition of some amount of fat inside the artery. Some amount. That delta amount may be very small, very less, but it will be there. So as a result of it, fat from one side, salt from other side, and sugar from third side, which causes a problem. So at any given point of time, you should also avoid sugar, so that your density of blood should not increase. So sugar should be avoided, okay? Because we have plenty of glycogen to get our energy, we have plenty of fats to get the sugar from the fat. So only thing is that we should have a fat shift from there, so we should avoid sugar. So third thing is this. Then in any diet we should have the raw food somewhere, and also a chunk of fibers. Fibers can be soluble fibers, non-soluble fibers, or insoluble fibers, but we should have fibers somewhere. You will find so many videos on smoothies to reduce the blood pressure. There are smoothies of, say, for example, the betel leaf plus one banana, then there is the black pepper, and then cinnamon. These kind of things are put into smoothies. Some smoothies are for ash gourd or white gourd or bitter gourd smoothie. So these smoothies, all these smoothies have two functions. One function is that some of them they reduce the density of the blood, but it's not like they are reducing the density like they are making it water. No, it's very infinitesimally small. Probably after 3 months you will come to know that okay, some difference is there. So that is one function. And second is that it provides you the cleansing effect in your blood. So this cleansing effect actually makes your density lower and lower of the blood, and it comes to normal. And the second type of effect which it has, because of the fibers, it cleans the gut. Once it cleans the gut, then definitely that your gut is clean, everything is clean. Malam sharirasya cha vaidyakena. Very clear. Malam sharirasya cha vaidyakena. So the whole elementary canal is clean, everything is clean. And that is the reason why many of the Ayurvedic doctors or yogic sciences, they prescribe enema or basti, what we say. The person who has a very clean large intestine, very clean say colon and rectum, that probably very less chances that the person will suffer from the blood pressure, because everything is clean. Once the gut is clean, naturally it provokes the whole body to get it clean. So gut is the key. So anything and everything, most of them, they are connected to gut. Most of them, gut I mean to say elementary canal, mouth to anus, right? So no doubt that the kriyas like shankha prakshalan or mahashankha prakshalan or dauti, they should be avoided by people having blood pressure, but uh, the basti can be done by the people having blood pressure. It is always recommended that at least once in a week the person should go for basti. And basti is nowadays there are pots are available, there are even a small tube can use for basti, and you can clean your gut completely. So basti is very important for blood pressure. Every day fibers are important for blood pressure. Coming to the fruits, almost every fruit is good for blood pressure, except some of them you can try that because of high sugar content they could be avoided, like sapota, custard apple, or too much of sugar cane juice, or what you can say is grapes. These have a lot of sugar, and then it will have its antioxidant effect as well as it will have a sugar effect. So because we don't keep control over the quantity, so as a result of it, they should be avoided. But all other fruits, they have, especially berries, any type of berry fruit, that are very good for blood pressure. Again, if this berry fruit, cranberry or blueberry, or those fruits, they are taken in very high amount, where there will be indigestion or there will be a dysentery, that is not good, because that also causes a problem. It should be taken every day for long time. Rather, my request is that the person who's having blood pressure should go on a fruit diet one day. One day in a week, the person should be on, the next week, of course not the same week, the person should be on just the buttermilk diet. It is also said that if you have 16 hours of fasting, the intermittent fasting, so you will get very high results on blood pressure. So 16 hours of fasting is also recommended. If you cannot do 16 hours of fasting, please try to do at least 12 hours, because 12 hours is a very normal, you are living a very normal lifestyle, so at least 12 hours. So never allow your body to get dehydrated, otherwise you will end up in drinking a lot of water later, right? So drink water in between. Those are the some of the key things from the diet point of view about blood pressure. Coming to how say how we should have approach towards the towards our asanas. And before that, one more thing I would like to mention about say the methi has a very good effect, or you can say that the Chut Shekhar has very good effect, Arjuna Arishta has good effect, cucumber, these have good effect. There are a number of different medicine. Copper bottle has a good effect because copper has a good effects on blood pressure. It is also said that Rudraksha has a good effect on blood pressure, right? There are many studies are going on, and these particular studies, they are connected with the statistics and not with the actual one, because the result is after 3 months, 4 months. Okay, even garlic, lemon and ginger smoothie, these particular thing has a very good effect on blood pressure. So lemon is a key factor where it has citric acid, but its product are basic, right? So unknowingly, what we can say that if you have a basic water taking, or if you have a water like lemon and cucumber and water, which you can say that the alkaline water has a good effect on the blood pressure. So coming to the yogic sciences, I'm sure Vaishali ji has conducted a lot of very good sessions covering the Vrikshasan, covering the Padmasan, Prarthana pose, and very slow Surya Namaskar, and Shavasana also, Vajrasan. These asanas has a very good effect on blood pressure. Very important point here, what I can say about exercise asanas. Understand this way: the very fast, or say ridgati, or very quick exercise, very pressurized exercise may cause a damage, but exercise is important, because without that there won't be a blood flow, proper blood flow, there won't be increase in metabolism, and there won't be any cleaning of body. No doubt about it that people say if you have 20 drops of sweat every day, the person will actually reduce his blood pressure within 3 to 4 months to proper. Of course, it is a not more than 140 or 150. Then 20 drops of sweat can definitely help to bring that blood pressure to the normal. So asanas like child pose, or Vajrasan, or Marjarasan, cat pose, and Sukhasan, with along with the processes or the kriyas of Pranayam, these definitely normalizes the blood pressure, because it slowly calm down the body, the requirement of the body. It calms down the requirement, but at the same time keep the metabolism same, and that is where the beauty of yoga is there. All yoga, all asanas are actually a part of one particular portion of it: yam, niyam, asan, pranayam, pratyahar, dharana, dhyan, samadhi. So one asana is a one portion of it. If you probably go for kriya yoga, or if you go for the say the Ishwar Pranidhan, then there is a huge effect on your blood pressure. If you do your some of the sadhanas in sun, exposing your body to the sun, and that is also very good, it is said, for the lowering of high BP. All asanas, they are fruitful when you end up with shavasana. So very important, shavasana is as important as other asanas. Some of the people, they refrain from shavasana and then they just say that boss, asanas are over, now let me immediately log into my office laptop and start it. If you are not doing shavasana, you are damaging your body. So shavasana is equally important compared to all other asana. Whenever you do asana, whenever you go for any asana, you should know where should be your dhyan. That will actually give you lot of benefit. If you keep your dhyan, say if you are doing, suppose say Ashwa Sanchalanasana, and your dhyana is on the toe of your leg, then it won't have that much effect. Your dhyan should be on the Ajna Chakra. When you are doing a cat pose, definitely your dhyan is definitely on the your vertebral column or backbone. So it is also said that the asanas are to be performed very slowly. So Trikonasana, for example, you are performing at a lateral bend, should be very slow. Even if you do Paschimottanasana, Padottanasana, you should perform it slowly. Of course, forward bending asana are not that much recommended in high blood pressure, but you can try very slowly and then you can stop yourself whenever you feel that no, my pressure is increasing or I'm not feeling well. Stop it. Very, very important. Just stop it. So, Baddha Konasana or bound angle pose, it says that it stimulates the heart. So that's those kind of asana, or say Ardha Machindrasana. It stimulates the whole nervous system. But it has also effect on your pancreas. It has effect on your twisting your complete backbone. But it has an effect on even high blood pressure. But again, if you overdo Ardha Machindrasana in first go itself, then it has a problem. So if you go for say Janushirasana, and if you find that in Janushirasana you have some uneasiness at the say chest or in the abdomen, so your uneasiness should not be pathological, it should be physiological. Very important. If you are doing your Vajrasana, and in Vajrasana if you have a problem of say varicose vein along with the blood pressure, that's a problem. You should avoid it. So again you have to remember which cross disease you are suffering from, which particular cross disease you are suffering from. All these things I am telling with all those people who doesn't have for example the different cross diseases, right? Otherwise it may happen that particular disease, particular asana is given for a particular lowering blood pressure but may not be useful for the other disease or may aggravate other disease. So that is also very important. So coming to the one more portion of the yoga, that is Kumbhak. As far as possible, there are questions which generally appear for particularly for Kumbhak. Should we do Kumbhak? My request to everybody is that unless and until you bring your blood pressure to normal, better to avoid Kumbhak, because heart has to pump the blood very high to reach that blood to every arteriole, every capillary, to provide the oxygen, to provide the sugar, okay, to provide the food. Now if we try to do Kumbhak, we are dearth of oxygen in Kumbhak, especially in Bahir Kumbhak. Antar Kumbhak, it may increase the blood pressure, but at the same time, but in case of Bahir Kumbhak, you may lack the oxygen partially in your cells and your body will be a kind of dearth of oxygen. It will actually craving for oxygen. As a result of it, it will give feedback to the heart, pump the blood, and as a result of it will shoot up the blood pressure. So better kumbhak should be done not now, after your blood pressure comes to normal. Needless to say that you are doing yoga, you are on diet, so alcohol, caffeine, and also smoking or non-veg, better to stay away from them. Alcohol has very what you can say, a funny physiology. In very small amount it stabilizes the blood pressure, and once the amount is increased, it actually shoot up the blood pressure. But that very small amount will never become very small because of its psychological dependency. So that is ultimately said that it is better not to have alcohol. Nicotine, which is a very lipophilic molecule, which goes inside our brain straight. There are some molecules like nicotine or alcohol which is actually can be dissolvable, which is soluble in fat, and that can straightway cross the blood brain barrier and goes to brain and has an effect. Nicotine shoots up definitely the blood pressure and increases the actual the tenacity or the plasticity of our blood vessels. As a result of it, you will find that people who are long term nicotine consumers, they will have either a tumor, because it also proliferate the malignancy. They will have blood pressure. Needless to say that by that time sugar will be there definitely. Correct. So every day, for a person who is actually having blood pressure, every day he has to think in a way whether this particular thing is good for me. Celery seeds, yes, good for them. Cinnamon, yes, good for blood pressure. Okay. Ashwagandha, yes, good for blood pressure. Garlic, yes. Honey, yes, but honey has a problem. Honey, it may have a lot of sugar. Sucrose, adulteration is very common in honey, so definitely you have to check that. Very difficult to get sugarless honey. Basil or tulsi, yes, it is good, it is very good. Even celery is good for blood pressure. N number of different vegetables, they are very good for a blood pressure. As a rule, every day one should practice at least 10 minutes of keeping themselves meditated. I'm not saying dhyan. Dhyan is where you will have a dharana and then you will have concentration, that is dhyan. I'm saying meditation, just close your eyes. What Vaishali ji had just conducted for a very small period of time, but that was so relaxing. So every day you should at least have 10 minutes of dhyan or 10 minutes of meditation. You can also try for Tratak initially and then go for the meditation. So these are some of the key points which I would like to just cover it over the period of this last 50 minutes. So thank you so much. If you have any question, please go ahead, and I'll definitely try to answer it. You can open your mic, no worries. Let me go through questions.
Thank you so much, Mr. Raghavendra. It was really enlightening. And let us have all the questions, please.
Is homeo medication for BP and diabetic advisable? Oh, it's a very tricky questions. Although I am not a homeopathic doctor, and see, I can tell you the base of it, so that you can take this particular thing to your physician and you can think over it. Homeopathy has two bases. One is constitution based, like some constituent of your body is reduced. And second is the symptom base, like whatever symptom produced by that drug should match exactly with what disease is producing. Okay, so both the ways homeopathy treats, right? So as a result of it, the exact drug is very important. So the person who is your family physician, go to homeopathic family physician, better to go to him, because the person will know your body right from the childhood. And that is where you can definitely go for homeopathic or Ayurvedic medicine. About Ayurvedic medicine, I think there are quite a lot of medicine which are well prescribed by the physician. So, but definitely if the blood pressure is very high, you should ask your doctor that should I go to, or can you refer me to allopathic doctor, because high blood pressure, very high blood pressure, can lead to even the cost of life. Yeah. So there is a question. There's a question on medicine. Arjuna wrist can be taken for mild level of hypertension. Of course, I'm not a physician with a big rider. Actually, this particular question, it's a big rider. Terminalia, I can say you the base of it, and you can take your decision with the help of your physician. So Terminalia Arjuna, which has alkaloid, which helps to for the as a tonic to the heart, right? So Arjuna Rista is considered as a tonic to the heart because of these alkaloids in it. So as a result of it, it is prescribed in whenever there is a cardiac output is less. Generally people have 60 to 65% of cardiac output, and if they reduce below that, then Arjuna Rista is very helpful for that. But of course there are n number of different parameters are there on which this particular medicine is to be decided. We generally go for the pharmacist advice. So my request, though I am a pharmacist, my request, don't go by pharmacist advice, go by the physicist advice. Okay, I know that that amount of money is worth, because if he's your family physician, he's checking you properly and giving you advice, it is worth, because the trends are known to pharmacist, not the body he has to study in depth. The critical analysis, differential diagnosis is not with the pharmacist, is with the doctor. But medicinal chemistry, physiology, pharmacology, as well as the pharmacognosy, phytochemistry, all these are known to pharmacists. So there we should not compare our pharmacist with the doctor. We should start with the doctor. So so my request is, any drug if you are taking, whether it is Ayurvedic or allopathic or homeopathy, please my request is, go to your physician. How to take care of heart muscles build up? Please provide necessary remedies. Very good question. I think there is a very good video of Dr. Hegde, okay, from Tamil Nadu, and he has given it the how to build the heart muscle. The best way is building a heart muscle is that where the we do ushtrasan, where we keep our both hands in front and try to bend ourselves from knee with breathe out. So in this case what happens that our heart, that dearth of oxygen is there, so it build our arteries as well as muscles. The second way is that at least 2 times a week our heart rate should be increased with the exercise. That heart rate, there is a formula for that heart rate also, you can get it on net. The formula depends on age. Our heart rate should be in a at least 2 times a week for 80 minutes, total 80 minutes in a week. So 40 minutes, correct? Our heart rate should be higher and higher, so that the muscles of heart, the cardiac muscles should be healthy. So at least 2 times a week. So this is a question. There is a lots of questions are there, I think. Okay, how to reduce the protein leakage in urine? Very important. Protein leakage in urine is nothing but actually a challenge in kidney. Okay, or there's a challenge of maybe of sugar. Immediately you should see the doctor. Immediately you have to perform the test of urine and blood. Very important. Okay, to reduce that, of course, there is a in yoga there are different mechanism is there. You have to do all those asanas which increase the blood flow to kidney. You should do ardhamachindrasan, you should do ashwashanchalanasana. Okay, you should have to do the leg spread asan, kapotasan. You should have to do the parshvakonasana. Okay, then you should have to do the anjaneyasan. Then you should also do the kind of asanas which will have the complete twist of our middle portion of the body. Okay, all those asanas will help you for the all groin related or abdomen related diseases. Very important. But of course you have to do it with every month or every bi-monthly analysis, and you have to keep a doctor informed in this case. Because if your albumin or some protein of blood is going through the kidney and going to the urine, it means that kidney has a challenge. So this challenge we should address immediately. Very important, and it's a little bit of serious condition. I have the pre-BP and no diabetes, but mouth is getting dry during night. Any reason, and what is the home remedy? Mouth is getting dry because it's very high time. It may be very simple reason that you should have to take water, right? Because over the period of 8 hours 7 hours we don't drink water. So it's a everybody's mouth get dry. But pre-BP condition is not good, definitely. Okay, let's go to the next one. After taking medicinal BP, it is normal. It is normal range. Can we do kumbhak? Here it's a very good question. Now let's see the physiology of it. What happened? Either you have a maybe beta blocker or calcium blocker, or you have probably some diuretics or some antihypertensive drug you have taken. As a result of it, definitely the blood pressure remain this one to the normal, but at the same time your density of your blood is same. The blood pressure may be reduced to a normal. You can do kumbhak, definitely, but it is always a very big caution. When you do kumbhak, you have to check the blood pressure afterwards immediately. Means, for example, if you do yoga, after yoga you check the blood whether your blood pressure increase beyond limit. Because if you do kumbhak, definitely the want of oxygen increases, but at the same time kumbhak will also have its good effect. So over the period of time, if you are doing kumbhak, naturally you have to have certain rules and regulation before that. You cannot do kumbhak directly. First rule is that you should have 25 minutes of vajrasan, 25 minutes of padmasan. If you can do that, probably you will first get rid of blood pressure itself. Depend which tablet you are taking, again that is very important. If you are taking 2-3 tablets of blood pressure and if you are doing kumbhak, that is not correct. First you actually go for getting those tablet rid of it. First, whenever you see that no, my blood pressure doesn't shoot now for almost 3 months, you should go to doctor. You should say, I am regular now in my diet, in my exercise, in my yoga, in my meditation. Can you please help me? That is there any way that I can reduce some of the tablets, maybe 2 3 tablets you have? And doctor will let doctor take that decision, that to reduce the tablet. You don't take that decision, I don't take that decision, because there are a number of factors are there which are involved in it, and these factors, the doctor will think of it, and then only the doctor will reduce the tablet. But once you reduce the tablet, you will find that after, when you get rid of tablet, after that you can definitely go for kumbhak when you get rid of the tablets. But it is always better that uh, uh, you cannot have a nuclear bomb and you can play with the nuclear agents, so that cannot be done. Okay, so here you are taking a tablet and here you are doing a kumbhak. Instead of that, make your BMI between 18 to 24 and then go to doctor. If your BMI is more than 24, better not to do kumbhak. Okay, there is one more question. Is there any relation between migraine, high BP? What is the best remedy, asana medication for migraine? Migraine, the first of all, the reason of migraine is ultimately why medical science is unknown. This is the research, that there is no reason they know. The migraine has, again, they have tentative reasons of it. It may be because of shooting of BP, they say, or throbbing, not shooting, throbbing sometimes. I have seen migraine by keeping your neck only on one side or on either of the side. Over the day, it may cause migraine. There are cases where seen that the sugar is less and cause migraine. There are cases where the too much of salt is taken and cause migraine. Too much of sugar plus fat, like if you eat say samosa, and that corner of the samosa, if you take 4 5 samosa and that corners along with that the vanaspati oil that has, it will definitely cause migraine. So migraine, one of the reasons they say that maybe because of the, not because of high BP, but because of the throbbing it occurs. So throbbing may cause migraine, or it may be because of the monthly cycle which has a disturbance in the hormone, that may cause a migraine. So there are asana, cooling down your complete brain. Asanas are there for migraine. So there is a separate discussion on migraine. I'll have that video. I'll send it to you. Cooling effect on brain, how that can be done. But it is said that if you directly eat olesan or garlic, or if you eat the ginger, then there is a partial effect on migraine to get control. Asanas, there are cooling pranayams are there, where migraine, or shitali or shitkari, or say very slow anulom vilom, all these will stabilize your neural system. We would like to rephrase the how to reduce the heart muscle build, which is already present on heart. Sorry, I could not get this question. Would like to rephrase how to reduce the heart muscle build. So heart muscles are very much required. I think the person wants to say how to reduce probably the deposition on the muscles build. Probably that is a atherosclerotic condition which is there. The person would like to say that. Definitely.
Yeah, Rajendra, shall I interrupt?
Yeah, sure.
It is a question from me.
Yeah.
This is Manish.
Yeah,
It
Manish.
was a nice session.
Thank you,
Rajendra.
sir.
This is look like a 2D had done for my heart, and then doctor was is saying that the muscles are built, and so the passage of the blood, it may reduce. So what he was saying, the muscles are built up already, so you need to take the medicines. So he prescribed some medicines to me, 40 mg and all. So then after some time, like after taking the medicines, my BP reduced to 130/90. So would like to know. He told that it may take some time to revert the effect of these muscles that is built. So he said he told me to go for the Vyama exercises and all those things. So I just wanted to know how we can reduce with the help of food intake and then yogasanas.
I have a question. See, again, this may be my very mere understanding. Because of that, probably this question I have. So myocardial muscles, which are actually responsible for all loved up sound, or which are responsible for compression and relaxation, if they are built more, what is the problem in that? Yeah, Manish, you ask doctor this first. What is the problem in building these muscles? Hello, you are on mute, Manish. My question is, see, if I build fat, it's a problem. But if I build myocardial muscle, what is the problem?
I think it maybe he is trying to say this is a fat developed.
Yeah. So please ask, because this itself, the question itself, that if it is a fat developed, it is a kind of atherosclerosis which is inside. Outside, if it is a fat developed, it is a different condition, where definitely outside the heart or on the heart, if there are fat or there are some deposition are there, they are easy to actually get rid of. They are very easy to get rid of. Correct. Say all those asanas which give a little bit of pressure to chest, those could be used for this. Say for example, you can do Garudasan, Bhujangasan. You can also do Gomukhasan, and you can also try Gomukhasan along with the Kapalbhati, right? You can have the Yoga Mudra, right? You can do even do the this Shashankasan along with the when your hands are at the back, the Shashankasan type 2. All these can be done for this, or even the yogic breathing from chest is very useful for this, for particularly this
Chest expands.
expansion of chest. Basically, it is your blood flow is more and more to the chest. So I feel if there is no other challenge you have, I think you should go for a good kind of jogging also, which will have with very good shoes. But jogging, and most of the jogging, the whole thing should come on your the whole pressure should come on your chest. Just a minute, I have probably a battery challenge here. Just a minute. Yeah. Yeah, please go ahead. Your next question. Push-ups is advisable for the moderate BP. So see, this moderate BP, it's better to avoid all these heavy kind of exercise. Okay, because you are taking tablet. If you are taking tablet, and if you are doing push-ups, and then it will generate heat, and it will generate more amount of definitely metabolism will be good, but at the same time the pressure will be high. Correct. So my request is that you reduce your BP, reduce your weight, make yourself healthy, and then go for the more and more vigorous exercise, more and more vigorous challenges. Better to bring your BMI between 18 or 19 to 24, and then go for push-ups, go for halasan, then go for sarvangasan, go for Mayurasana, all those asanas. But better not to go for them. Consider that you are building your complete body to reduce the BP first, and then you go for the all those difficult asanas. So that is my request. Of course, 80% of the time nothing will occur. If you are taking a tablet and you are doing push-ups, your colleague is doing, nothing will occur. But at the same time, this 20%, we cannot take that 20%, because you get only one chance in case of brain. So okay, how to reduce creatinine? Again, this is a very physiological, very a question. But my request is that those asanas currently which Vaishali is taking every day, and the asanas which gives you a complete blood flow towards the kidney. Even those asanas which I just given for, particularly the trunk asanas, that will also help to reduce this, particularly the creatinine. One more thing is that if you drink moderate amount of water, definitely it helps. Reduce your fat plus uh, fat plus high glycemic index food. Reduce that is one key portion of it, because indirectly then otherwise it will shoot up your unreasonable contents of the blood. So better not to have even a single day where you are dehydrated. Okay, that is one thing. You should always be hydrated properly. Never have any uh, chunk of food where there is a oil, fat or vegetable oil packed food, along with the very high glycemic index food like ice cream or sweet. People have habit of putting a gulab jamun inside the ice cream, hot gulab jamun and cold ice cream, my god. So don't do these kind of thing. And if you do regular exercise where there should be a 20 drops of sweat, so probably 6 months it's enough for bringing it to back to normal. Okay, I think we have already shoot up 12 minutes more. So I request, if there is any question, you can post me definitely. I will answer them. I'm always there. My employee ID, you can note it down, and my number is also there. You can definitely reach out to me. Good questions which will pave me or compel me to study more. Okay, so thank you for that.
Thank you very
Thank you so much.
Very nice and informative. Beautiful. Very rewarding session. Thanks.
Thank you so much. Thank you, Vaishali. Thank you, Gyan. Thanks, Priyanka. Thank you so much.
Thank you so much for this wonderful session, Rakesh. And thank you all for joining. A great day. Thank you.
Thank you.
Thank you. Bye.